Hi, I'm Rachel Wall, CEO and founder of Inspired Hygiene. And what I'd like to do here for the next few minutes is give you kind of a behind the scenes look at an actual hygiene growth roadmap report. What does this look like that we share with our clients? And what could you expect if you choose to do the hygiene growth roadmap now? So let's take a look. Okay, so let's first take a quick look just at the hygiene growth roadmap report. So as you can see, this is about a 4 or 5 page report. We're looking at supply and demand, recare and scheduling, perio awareness. We do a virtual chart audit to look at documentation and diagnostic quality of what's being collected, service mix, restorative co-diagnosis potential, fees, and then we look at profitability, and then we also look at specific action steps. This is really your roadmap to achieving ultimately what we share with you are these growth projections. The next thing we do is a 1 hour debrief where we really share our thoughts and expertise and what we're seeing in the practice and where those growth opportunities are, and really giving you the roadmap with that. So we start with this here, and I'll share with you some details on this particular practice. Okay, you saw in the report that we showed just a moment ago multiple lines of growth potential. This is where we look at what is immediate, what can we really uh, give some value to this doctor practice owner to achieve some immediate growth within their practice. And you can see that we really try to take a pretty conservative approach to this, right? 50% of adult new patients having some level of disease completing 2 quads of therapy would yield this much in additional practice revenue. 10% of adult recare patients completing 2 quads of periotherapy would achieve this much. And what you're going to see with this practice is this is extremely, extremely conservative. One of the pieces that's very revealing is typically the virtual chart audit. And what we found out with this particular client is that 40% of the x-rays that were in the charts that we audited were actually of diagnostic quality. That means 60% were not of diagnostic quality. This is really important for a practice owner to know. Are the radiographs that they have holding back diagnosis? Are they creating some risk in this practice? This practice is a pretty high participator in PPO plans. So submitting radiographs for reimbursement that are not of diagnostic quality may create an issue and also trigger an audit. So these are things that we really want to know, right? We also saw 0% of the charts that we audited had all pocket depths recorded. So they had a lot of areas where there were, maybe the molars were recorded, but they didn't have a full look at what is the perio state of these patients, and that's something that they can correct actually pretty quickly. Okay. You can see their perio awareness was 1%. So 1% of their patients that are in hygiene are having perio related procedures. All right. This was their average amount of quads of scaling root planning per month. Remember, they have 4 hygienists. This is a very busy practice. So there's nowhere to go but up was basically the doctor's quote when we did this debrief. He said, the good news is there's nowhere to go but up, and we've got you to help us implement these protocols. So they moved quickly into coaching, and we're working with them to really establish a very strong perio foundational protocol that they can then build on over the years, and we can help them expand and evolve that over the years together as well. It's no surprise that with the low variety of service mix that they had in hygiene, it's very prophy heavy, that they are about $80,000 shy of achieving that 3-to-1 profitability point. Now, there are a lot of things that go into this that we share with them, whether it is the reimbursement rates, whether it is a service mix, whether it is a scheduling issue. You can see we've mentioned a few things here, but we always look at that as well. And we always want to give the client some quick wins. So these are things that they can do within the first 30 days of this hygiene growth roadmap debrief that can move them towards shifting the protocol, shifting the mindset of the hygiene department, and certainly shifting towards some of that growth. And one of these for them was to make sure that there's a complete perio chart on all patients that don't need x-rays, right? Maybe that's where they start instead of looking at, oh my gosh, every patient that comes in is going to need a complete period charting, and how are we going to actually get that done? So our advice to them is just start with the patients maybe that don't need x-rays that are coming in today. And during that time, do that complete period chart and come with a plan of how the hygienists are going to be supported in doing that. Do some x-ray training with the team. Find somebody on the team that is very good at taking those diagnostic x-rays and have them do an in-service with the rest of the team members so they can improve that percentage of x-rays that are of diagnostic quality, and really just start the communication with the team about the need to update the perio protocol. And then, of course, we're going to give those action steps that you saw in the report, and we're going to give them some strategic recommendations, some first things that they need to focus on that are going to be a little bit more long-term. These are things that are going to take a little bit more planning. They're going to take a bit more expertise to really put these things in place. And this is often where the client chooses to work with Inspired Hygiene because we can facilitate this. We have proven systems to get these things in place and really work with the team to really kind of speed up the process on these strategic recommendations, getting them in place quickly so they can start to see some of that growth happen within the first couple of months of working with us. And of course, we always want to look at the client's objectives, make sure that whatever we're recommending lines up with their objectives, and that we address that and make sure that they feel heard and that we are tracking towards helping them to achieve these desired things within their department. So that's just an inside look at the hygiene growth roadmap. We'd love to have the opportunity to do this for you. Please email us at clients@inspiredhygiene.com, and we'll be happy to answer any questions and help you get started.